If you've tried many different pain treatments and you still are experiencing that chronic pain, consider coming to see a mental health professional. Hi everybody, my name is Dr. David Johnson. I'm a licensed clinical psychologist here at Ogden Center For Change, and today we're continuing our video series with Aaron Bergen of Suicide Sucks, a nonprofit organization based here in Ogden as well. And so today we're going to talk about chronic pain. This is an experience that millions of Americans have. In fact, if you take all the people who experience other chronic conditions, diabetes, heart conditions, and combine them, it's still less than the number of people who have chronic pain. And what I mean by that is pain that has a lingering effect on a person, that it's not completely eliminated by a medication or some other medical treatment. And the reality is we don't even fully understand the brain mechanisms of pain, but we definitely understand that there's a mind-body connection, that the effect of our mood, our relationships, our well-being, that can either increase the experience of pain or decrease the experience of pain. And pain obviously is driven by these sensations, these neurons that are receiving input from our body, but it's interesting how strongly they're connected to our brain. And so what I want you to know is that if you've tried many different pain treatments and you still are experiencing that chronic pain, consider coming to see a mental health professional. The research on this is that people who have therapeutic experience, go through therapy, receive treatment, also experience a significant decline in that chronic pain. Not to say that it's eliminated, but often what happens is a person's relationship to their body or to their pain, it shifts. And so let me talk about one example of this. So there's some research studies, really neat research studies, where people take their hands and shove them into ice buckets full of ice water, giant chunks of ice floating in there. So you can imagine after just a few seconds, it starts hurting. And they do these studies showing which people are able to tolerate that pain for a longer amount of time. The people who are instructed to shove their hands in this and try not to think about the pain, try to ignore, try to pretend like it's not happening, those people oftentimes have a shorter duration of time with their hands in the bucket. They just can't handle it. And I think that's really similar to what people are trying to do with chronic pain. They're trying to force it away. They're trying to pretend like it's not there, to ignore it. And I understand that, right? I've had a back condition where anything I would try to do, it would just come up, and it would just depress me. It would make me feel hopeless about life, and then I would say, well, I might as well just not go out and do anything anyway today, and I would just kind of give up. And the other side of the coin, the other group of people, they would ask them to put their hands in these buckets, and they would say, go ahead and allow yourself to experience the pain. Allow yourself to think about it. Allow yourself to focus on it and even describe it, even put words to it. Those people, ironically, had a longer duration in the bucket. And this comes from this practice called mindfulness. So mindfulness is all about becoming aware in the present moment. And oftentimes when we just face what we're really going through, and I don't mean agree with it, I don't mean like it. Of course you're not going to like the pain you're experiencing. But what I mean is accept it, that this is a part of life, and now learn how to work with it. Can I bring some gentleness to it? Can I bring some compassion to it? So here at Ogden Center For Change, we're trained in these approaches, and we want to help you learn how to relate to your pain differently. One of the primary treatments we do is this mindfulness-based approach, which has years of research experience now, helped people with many different types of chronic pain and other conditions too, like fibromyalgia, which just have this general body effect, general fatigue, general pain, with really positive results. So we'd like to teach you that skill. We'd like to help you have a life that's meaningful again and fulfilling. And some of that pain will come right along with you, but there's no reason that you can't accomplish some of your dreams and in different ways, to go at your dreams in different ways. And so we understand pain, we understand what it's like, and we'd like to be an adjunctive, supportive part of your life, along with your physicians and your other medical professionals, to help you reach a life that's truly meaningful for you. So if you'd like to come in, we have almost instant access to care here. We want to get you in the door as soon as possible. We'll be flexible to get you appointments. So please give us a call at 801-781-5733 or go to the website at ogdencenterforchange.com. Send us an email and we'll get you set up right away for initial consultation. Thank you.